with this event is simple. Cities are crucial partners in advancing the climate and health agenda. And as member states review the progress on the Global Action Plan next year at the 80th World Health Assembly, we hope that the contribution of cities can be taken on board. And I'm looking at new growth ambassadors who will have the task to review this Global Action Plan on climate change. So to explore this issue for more, the health plan using this data and engaging with the meteorological ministries to really having some more surveillance, disease outbreak, but also for early warning system, for extreme heat, etc. As the third key pillar of the Global Action Plan, and I think this is the most relevant for the discussion today, this is the country-level action and capacity building. The WHO is supporting countries to ensure that health systems are climate resilient to extreme weather events, heat waves, flooding, vector-borne disease, etc. At the same time, they're also trying to push to support countries to have also low carbon health systems and environmental sustainable health systems, facilities, with the electrification of healthcare facilities and also the supply chain. So we are really trying to make the case for the health sector to be also, so this is to be also mitigating air pollution. So this is really a shift in the approach, because so far there has been a lot of focus on adaptation for the health sector. That was really the main discussions, while engaging with the health sector, which is WHO's main partner. But there has been a shift in trying to also mitigate, or at least trying to address this mitigation aspect within our house, right? So this is a key point also. Of course, there are also activities that WHO is doing. As you mentioned, I am not a climate expert. I'm more working on air pollution. So under WHO's work, there is a lot of other environmental risks, and air pollution is one of them. And air pollution is one key entry point for mitigating climate change. They have a lot of common sources. And this is also something that we are trying to address. Really, on air pollution, we have been addressing more other sectors than the health sector. So more energy, environment, urban planners, agriculture, etc., trying to really prevent emissions to start with. So not the adaptation, but more the mitigation part. When it comes to cities, I think we have been just addressing this very, very clearly. Where they are at risk, they are, of course, on the front line. WHO is not originally designed to work with cities. We are addressing normally ministries of health, but it does not prevent us from working with cities. So there are a lot of projects working with cities or subnational governments. I will not mention the standard one that are Healthy Cities Network that are famous, not specifically on environmental health. But in terms of environmental health, I just wanted to mention two projects that we have been doing in the past, which was on climate change and health. We have been testing on trying to pilot health and climate city. I'm sorry. Country profile, city profile. Sorry, health and city profile, climate city profiles. This was a pilot project only done for 6 cities. We have also been working on Urban Health Initiative, which was an initiative trying to provide a framework to engage local governments to engage in a short life climate pollutant. So really working at the local level, trying to address household energy, transportation, solid waste management, trying to make health impact assessments. So the idea was really to test tools that we have to calculate health impact assessment and to influence policy making by choosing the best one. So I think for the coming year and to really encourage cities to work with us, there are several things. So first, as I just said, those WHO tool that we have been developing with experts, with the scientific community to really conduct health impact assessment, to really be able to calculate health and economic benefits of sectoral policies in the transport sector. We have various tools also to calculate climate co-benefit, etc. So this is really something that we can work with cities at the technical level. Directly. Yes. Without, going through the national government. We have done that in the past. This is possible. This is, of course, not a natural path, but nature is not always straightforward. So this is possible. Another thing is to engage with the ATTACH. ATTACH is the Alliance for Transformative Action on Climate and Health. This has been really an outcome of the COP26. And this is the idea is to really realize the ambition to build a climate resilient and sustainable health systems using the collective power of WHO member states and other stakeholders. And the idea is really so ATTACH mandate is also not national, but its implementation pathways also explicitly include cities, municipalities, subnational health authorities through a wide range of activities, such as advocacy, technical support, knowledge sharing, monitoring, and access for financing on climate adaptation and mitigation. So I think that's 2 things. And the last one, I just want to close with we have another initiative which is called Beat the Eat. So Beat the Eat. So eat and health is really something very passionate at the moment. It's very high on the agenda. So WHO has an initiative targeting workplaces and mass gathering, but really the idea is to provide guidance, support at country level, but also possibly at city level to really protect people from heat waves, but also to incorporate other risk factors like UV radiation, air pollution, etc. So this is also something that we are doing. So with this, we just to close and thank you for your attention.
Thank you very much, Sophie. And just a question: the Beat the Heat. Is it with UNEP, the UN Environment Program? No, it's a different one. Okay,
no, it's just WHO.
Okay, yeah. Just WHO. Good to know.
Some part is, we also work very closely with WMO on providing climate services for health. But Beat the Heat is a different one.
All right.
Samantha is my colleague. She's in charge of that. If you have a question.
Thank you so much. And it's good that you highlighted those tools, because I think this is exactly what we're looking at. We're looking at both tools for cities to engage on the issue of climate change and health. And now we will look at how states can also engage somehow with the issue of cities. So thanks a lot for that. Embajador Xiaolian Salcedo, you are the ambassador of Peru, and Peru played a very important role. We call it a pen holder, basically. In supporting the adoption of the Global Action Plan on Climate Change and Health that was adopted last year, and to which we both referred in the introduction. So tell us, why was this issue so important for Peru, and what role do you believe cities should play in implementing the plan?
Well, thank you very much for this introduction, which is a little bit unjust because we were not the only ones holding the pen. They're also very able, another very able country or group of countries are holding the pen. And we will, I think, keep on working very hard on that. Why is it important for Peru? I will tell you in a nutshell, because you stated very much the situation that we live all around the world. In Peru, we have, I think, 92 or 93 zones of the known 108 zones of life. It's a very multi-diverse, ecologically speaking, multi-diverse country. So what is good for the south of Peru, for example, is very bad for the northern part of Peru. What is good for the coastal line in Peru is very bad for the Amazon jungle and so on. So it's a very delicate balance. That's one thing. The other thing is that climate change is depriving us from potable water. Our glaciers, the so-called tropical glaciers, they have they have disappeared in an amount of 30 to 40% of them if you measure this for the last 50 years. So climate change and the consequences on global health, climate change, are absolutely hitting directly in the belly of the Peruvian society, the Peruvian economy, the Peruvian politics. We have had crisis, political crisis, because of not a very prompt management of droughts and floods and alike. I know it is not the only place with that that these things happen, or that are also they have some consequences politically speaking. I was just thinking in Germany when they had this very small river, Ahrtal. It became a huge thing and destroyed a very important part of a beautiful city that I used to know. Well, when I was there before, it caused a very serious political damage. So then you can also see there is a connection, not only because they are the frontliners, the cities, no? The communities living real life, no? The frontliners in for the consequences of happenings of climate change events, but also they are the ones who really try to respond the best way. We have in Peru, we have designed a system of response which is quite efficient. I say quite efficient because I think theoretically I've seen this in the cabinet of ministers many times. It's well put, it's well defined. Maybe I think technically speaking, on the one hand, and financially, they're a little bit weak. No, we say we have 5 levels of emergency, level 1 and 2. Municipalities take care of it. 3, the regional government. 4, the national government. And 5, then okay, we ask for international aid. So conceptually speaking, I think this is very, very and very well done. But we still need some expertise, and we need some funding for that. You know? Listen, I am one of the that I was already always opposed when we talk with other colleagues that this funding comes from international organizations. I said no, they can come and they can help us out, but the main funding has come from Peru. Why? Because this will also show the political resolve, no? The political decision that Peru says, well, okay, I am putting my money where my words are, no? Basically. So that's why this is very, very important. And this is also the case for having the what we are doing internationally, we have together, um, have this resolution on the global action plan on climate change and health. We will keep on working for. It is a difficult instrument, politically speaking, to have at such a high level a document which is not only encompassing, all encompassing, which it should, it must, I guess, but also that is also workable, in the sense of being useful when you pull down all the echelons until the practical level. It is very difficult to encompass all situations. We know that. No?
But it is well drafted. It really has, like different objectives and.
Yeah, you don't know how many pens we have.
But it is interesting because it really provides recommendations to states, to WHO Secretariat, and then to other stakeholders, where I consider cities can join in, basically. So my question is really, is it possible to imagine in the future that cities will have, or not in the future, like tomorrow, an important role in helping states implementing this, this plan?
Well,
we put an urban emphasis.
Yeah. Well, in Peru at least we have a certain strict legislation in which the lower tier of our governments, the regional governments and local communities and municipalities, they are entitled not only to do things and to get funds and resources to do things, but also they're entitled to direct the action. It means that the national government cannot, just get into it and say, well, no, this is something we'll do that our way. No. So we have the legal structure in Peru so that local communities have this prevalence. That's why we have level 1 and 2 of emergency, for example. This is for the local communities to solve those problems. 3 and 4, or 3. We have regional governments, and 4, 5 international. That's a national call. It's for the national government to do. So yes, we have the short response is yes. We have in Peru at least. We have the legal framework to have this particular. How you would say
to consult
exactly
with local and regional governments. Yes. Great. Thanks a lot for that. Hopefully we'll come back a little bit, to the global action plan review in the discussion. Let me turn now to the Ambassador Daiko Potzel. You're the ambassador of the European Union since I think last September. Europe is the fastest heating continent, which surprised me, to be completely honest. I thought it was out.
Yeah.
We can feel it, next week it's going to be 30 degrees here in May. So it's.
Well, we love it.
No, but so cold.
Be careful how much.
Yeah. Temperatures are increasing at more than twice the global average since the mid-90s. So it's going very fast. You have in the EU integrated health consideration into the global, climate agenda. Since a few years, you've launched different initiatives, such as recently a strategic research and innovation agenda on health and climate change. So how do you see, as the EU, the role of cities and regions, maybe very importantly, more regions in the EU, in implementing that global action plan, which you also supported? And do you have any good examples of good practices in cities and regions that you can put forward in terms of, how they address climate and health at the same time?
Yeah, thank you so much for that. And
let me put the microphone here. Sorry, always thinking about online.
Thanks for having me. And thanks for the interest in this topic. And I was just thinking when you were talking about your experience in Peru, I think, and your questions on the role of cities. I think what is really key is to bring cities together, and there are numerous networks of cities worldwide, organizations that bring cities together. And I think this is really crucial to also bring this topic into those debates there so that they learn from each other and hear exactly what you're asking me now, bring examples to the table, what works and what doesn't work. And I think we can all, support those networks to be aware of those issues, to put it on the agenda and to really come together to work on this. So look, you were saying, Europe is, or the EU member states, they also feel climate change, very much so. And we have looked into the nexus with health and environmental policies for quite some time now. We feel the heat waves, we feel the floodings, and this particularly hurts us because our population is aging as well. And age brings, of course, a lot of health factors, health risks with it. So here, particularly anything concerning air quality, air pollution, so on and so forth, doubled with heat, is really causing huge problems, and that pressures also our health systems, right? So what the EU has done, for instance, is we founded in 2021 the European Climate and Health Observatory. That was funded by the European Commission and the European Environmental Agency. And that really is meant to foster cooperation of stakeholders so that they work with science, that they exchange knowledge in Europe, but also with international key actors. And that really is to get better at understanding and thus also finding solutions. And here also the Global Action Plan on climate change and health that you mentioned is really key, because it's kind of a push in that direction again, right? It helps us to continue along those lines. So that was really really helpful, really helpful. So the focus of the work plan of the observatory for 2025-26 is, for instance, to strengthen capacity building among national regional stakeholders, to really help them to address the impact of climate change. So that's one really important issue. And for us, this is so important because 70% of people in Europe live in cities. People, a projection says 80% by 2050. So that's massive, right? So the problem can only grow. And here, the first-hand experience of cities for us is really crucial. We also have what we call the EU Agenda for Cities, that establishes a comprehensive framework for integrated urban development, and also empowering cities to have a stronger voice in talking about, sustainable future. What does it look like? What do we need for that? What can we do? And in that, cities are really a strategic partner for shaping EU policies, and there's constant exchange with the cities to develop our policies.
And we have institutional mechanisms of that.
Exactly, we do. And I wanted to, as you were asking about sort of concrete examples, maybe give you a couple. The implementation, for instance, and I have to read those because I can't remember them. Sure. The implementation of nature-based solutions in schools in Solana de los Barros, Extremadura, as a green way to adapt buildings to climate change, or the reshaping of the urban landscape of Barcelona in order to improve livability and citizens' access to green spaces. I think that is really key, and you have that discussion in many cities in Europe now, and citizens are asking for it. Keep green spaces, or bring green spaces back into cities, right? I remember in my hometown, Berlin, we have this huge airfield of a former airport, and the city wanted to build housing, and the citizens went to a referendum and said, no way, we need this, what we call the green lung, in the city center. So that is really key, that we talk to our citizens and that they are taken on board, and cities have a huge say in that. Or measures taken by the region of Flanders to improve climate resilience of healthcare infrastructure, to protect against heat waves and ensure better ventilation, for instance, to prevent infections. So there's a broad landscape of things that one can do, and that are really helpful. And we've not talked about the importance of architecture and design in in counterbalancing sort of climate change impact. Here, I honestly think we can learn from other regions a lot. You know, if you look at, for instance, also the Middle East, you know, also architecture that is maybe lost already. You know, I mean the huge knowledge that is there, right, and the experience with ventilation and how you build buildings and stuff like. So there's so much we can learn from. And cities really and mayors are key interlocutors for us to exchange experience internationally, and hence also the global compact is so important, right? So yeah, I'll leave it at that.
Thank you for that, and I was glad to hear about this EU agenda for cities. I'll definitely go and look at that, and I'd be interested in the institutional mechanism for the EU to consult with cities in the same way that you mentioned the legal framework. Let me now turn to Cork, our first city representative today. Councillor Fitzgerald, you've been a councillor for the past 20 years, more than that even, and a Lord Mayor back in 2017, if my notes are correct. You've always got a very keen interest in public health, and I think you've been instrumental in the designation of the city of Cork in Ireland as a WHO Healthy Cities for the past 14 years. So we've got a little experience there. So actually, we invited you because, of course, you're engaged in, you know, this issue of climate change and health, but also because Cork will be hosting a mayor summit in October on climate and health. So why has your city chosen to engage so actively on this agenda? And also, it would be great for us to hear a few concrete policies that have delivered concrete co-benefits in terms of climate and health.
Thank you, and I didn't realize I did all that. But anyway, my name is, yes, I'm Councillor Tony Fitzgerald, and I come from Cork City in Ireland, and I'm delighted to be joined by not one, but two Denises. Denise Caller, Healthy Cities Coordinator, and Denise Keogh from Department of Health, from Wicklow, a lovely place in Ireland. So if you're coming to Ireland, go to Cork first, then go to Wicklow. But it's lovely to be here, and I've kind of always said that getting involved in healthy cities was really a landmark in my own life, because the community where I live, community activity would be my first love rather than politics. And apart from my wife and children, of course, and my grandson, who I can't wait to see tomorrow. You know, it's something that I'm interested in, but you know, there's a saying, you know, that when you go into one committee, you're asked to go into so many others. And I have found that in this family of healthy cities and health and well-being and climate and all of those critical issues for that, we all come together as strangers, but actually, like, we all leave as friends. And that certainly has kind of been something very dominant for me in the last couple of days, of actually meeting people that I've met at different parts of the Healthy Cities family. In fact, I was in Istanbul last week with Pinar, and we had a very good conference at the Health Forum, and then met so many people over the last couple of years that we've met down through the years. And then I'm just amazed at what our own officials do in the Department of Health, and our minister spoke yesterday. What is actually going on here in Geneva with the Assembly? And what strikes me is that would I love to bring a lot of local community people to these events to hear what people are saying about them, and have them in that place where that voice is heard from the people. But I suppose I'm deputising the Lord Mayor of Cork, for Councillor Fergal Dennehy, who's heading to Turin next week and is just back from Rennes. So we both come from local communities. So I suppose we hear that message, and we are their representation of what is happening at local level. And I think that's the reason why I got the invite, is because I'm primarily from a community on the north side of the city. When you all come to the summit in October, to applaud and to look in more detail at the work of the Commission. And I've got about 10,000 neighbours in my community. I was working it out the other day, but 6,000 of them in my community, because in my community, I think it's the people who live and work in your community. 6,000 of them work in the European headquarters in Apple. And it's just a 5-minute walk from my front door. So you can imagine in a community like mine, you have so many people coming and going in a local area, and the impact all of that has, on the community. So I just wanted to kind of bring that to a local level, because that's the reason why I think I've been invited, and to give that kind of flavour of what we need to do. And of course, Cork has been a city with a strong sense of identity in its own right, and we know where we came from, but at the same time we know where we want to go, and that's very important for us, for the future generations that are in our city. And not alone are we a healthy city, but we're also a mission city. A mission city. But that's not a badge of honor. That's a responsibility that we have in terms of how we take our work seriously. So we can have all the accolades and we can have all the different badges of honor, but actually, are we working at local level, having a positive impact on people's lives? And we're very fortunate in Cork and in Ireland, indeed, since we became designated a healthy city in 2012. And we're part of that transition to climate neutrality by 2030, and its role as one of Europe's mission cities. So it's not just about the theory and all about the conversation that's happening up there. It's about the practice and action at local level. And that's always my message. And when I come into this forum of people working in the WHO, is that if we're not talking about locals and actions at local level, then we're really not with it at all. And I'm very pleased that I see it right across my visits to various places. So the two kind of quick focus that we've concentrated on, is on food and on air quality. And again, just on food, Denise will kill me now when I say this, but I'm a celiac. Okay. So I have a gluten-free diet. And it's very difficult when you're traveling to have a healthy food option when you're not alone, when you're traveling, but when you're working. It is, but it could be better. And so I said, so when I talk about food, I'm going to talk about being a celiac, because if you don't have the food available to you at events like this or whatever, then you have other problems that you incur. So by the time we finish here in the evening, I have to find the restaurants that I can have a meal, because you're just picking up stuff. But food is really one of the things that we're working very closely with in our local area, and we have the sustainable local equitable food systems, and what this means by supporting local food growing, reducing food waste, and ensuring that healthy food is accessible to all communities, and not just to those who can afford it. And so how do we do that? And we've got a great initiative in the cities, like I'm sure many of you have, in the community gardens, where community gardens are spaces where people can come, meet with neighbours, have social interaction, which is vital to them, because they don't want to be housed up in their homes. They meet neighbours in a different setting, and they together, they plant food, set the seeds for the food, work together, and they kind of build community pride. So it's a very joyful and participatory event, and it kind of brings people together that connect, and it also, of course, it grows food in ways that reduce emissions. Now, if I was to say that to my local neighbours, what you're doing here today is that you're reducing emissions, they'd say, pardon? Or in Cork, they'd say, what? Like, so we don't actually realize that we're actually doing this already in our communities by having a health and well-being forum. So I think that's very important. And of course, working in the schools is crucial. Again, I would think our practice in waste disposal, this waste disposal came with the children knowing what to segregate from plastic to paper to waste. They were the ones telling us how to do it. So I think that's important. And these are just a few examples of what we do. And then of course the air quality and the the health to your lives. Again, this is really important because it is it's not just an environmental issue, really. It's a public health issue, and it affects respiratory health, cardiovascular health, and overall quality of life. And even thinking myself, and I don't mind sharing my personal story, but I grew up. Again, I didn't know I was a celiac, but I was asthmatic. So the smoke coming from the coal fires, family members smoking in homes, all of that. And, we had the health ban introduced by our Prime Minister on Taoiseach Micheál Martin. So all of those have been crucial in terms of our air quality. And of course, now we're trying to develop the need to use public transport, so cycling, the active travel programs, all of that, and they are challenging. They are really, really challenging. And I think the message that I received from my colleagues here this evening is communication and how we communicate and bring people along rather than impose these issues and policies on them. It must start with them. And of course, we also have the community gardens, as I've said, and we also have our warmer home system and retrofit. So in my community, we're going through a whole regeneration of the community, right? Not only in mine, but in other parts of the city. We're also introducing a new retrofit program in terms of upgrading the houses. And already people tell me how well that's received and how their bills have reduced, which means that they have more disposable income, which gives them the opportunity to go off and buy all the things they need. So there are the two examples, my personal and my kind of journey. I could read out a lot of the stuff I've here, which is very important. I know you want to get more conversation going. And of course, then, yes, we are hosting the Summit of Mayors with the Pan-European Commission, and delighted to do that and to be part of the journey forward, because the Commission has done its work. It has really put climate action and health on the agenda. But there's a lot of work to do now. The work that they've completed is really the challenge to us. And the first station to arrive at is in Cork on the 5th and 6th of October, where we will bring together as many mayors and stakeholders as possible in our city over 2 days. And you will get a taste of the community actions that we have at local level, but then it'll also be a really tough, hard discussion on how we can implement the four key points that Andrew will speak on in a second. So if you have your diary free and you have access to your mayor or to your political reps, we would really ask you to ask them to join us on the 5th and 6th, to kind of not to put that document on a shelf, but to put it into action.
And what we want, it would be great to, if we could work with you to make sure that the outcome of the Cork Mayor's Summit on climate and health can somehow feed into the global action plan on climate change and health that will be, reviewed next year at the WHO. I think there's a link to be made, even though it's going to be somehow a regional process. I think it can still feed into, the global process.
Final point is that we're preparing a compact.
Yeah.
That will be discussed, and there'll be a call to action for Cork, and it's funded by the Department of Health, and we're very grateful for our minister to fund this event. But I think that's the real issue of when we get down to discuss as politicians to lead that forward. But it's just not the politicians alone. It's that family. It's not the strangers now. It's the friends that we've met. Thank you.
Thank you so much, Councillor. Now, making the connection as well with the EU, because Ireland will hold the EU presidency
Correct.
next from 1st of July. Onwards, and therefore, you know, somehow there's a connection that can be made to the national level and then to the international levels. It's just a heads up, Ambassador. Coming up.
And we have our traditional monthly
and maybe for those who, you know, you've referred very often to the WHO Healthy Cities, most of you probably know about it, but WHO is one of the first international entities to have created city networks internally somehow within WHO and back to the 80s. And they have, you know, different healthy cities network in different regions. And of course, that's the European region. But it is important for, you know, those who listen to us to know that each of the regions have their own mechanism of WHO healthy cities. Let me now turn to another healthy cities.
Yes.
Dr. Pina Okiye, you are the Deputy Secretary General of the city of Izmir in Turkey. You are an academic, but you transitioned to local governance, and you lead on multidisciplinary initiatives, integrating urban well-being with a One Health approach through participatory governance. So you're very different in scale, very different in climate from Cork, but still you're very engaged on this agenda of climate change and health. So could you tell us how you link in, you know, climate change again with the health agenda? And maybe if we have time, I'll ask you a few questions about the partnerships that are needed for you to move forward with this agenda. But you have the floor.
Thank you, Alto. Thank you for having me here. I'm very happy to be all with you. Izmir is a member of Healthy Cities Network of WHO, and also is the city of very first city. Also, it's the first city mission labeled outside Europe, and also, for example, first city in Turkey organizing town hall COPs and also COP youths. This is the first of Izmir. This is the first issues of Izmir. Really, it's a, you know, it's a Mediterranean city, 4.5 million in population. It's a very huge metropolitan city. We have facing many climate you know, issues, flooding, heat waves, air pollution, and also you know, many different scenarios. Really, it's really a public emergency, health emergency. We are now at the moment we are faced. That's why our municipality is made a clear political choice. This is to place human, animal, and ecological system health at the center of the governance system, really. This is One Health approach, really. That's why it's not just a concept, it's a governing method for us, One Health concept. This One Health issue is also one of the first of Izmir Metropolitan Municipality, because Izmir Metropolitan Municipality is the only municipality in Turkey. Food and Bed One Health is one of the pillars of it in its strategic plans. This is also very important. I'm a medical doctor background. As a medical doctor, I know that health begins long before the hospitals. We should know this. We know the WHO just present this a very social determinants of health, you know, socioeconomic issues and other things, really. And today, one of the most important public health problems related also climate issues, but we have already told the, you know, food systems and food insecurity, for example. There is a very interesting approach, very you know, I think in a new approach, especially in Izmir. We decided to intervene this issue because directly we have just built some municipal markets called Izmar. I have just heard that New York Metropolitan Municipality Mayor Mamdani also announced such a thing just last week. They are also organizing some grocery markets for the disadvantaged groups. Now we have just approximately 20 markets. We created cooperative-based short supply chains connecting to local producers to the consumers, to the citizens directly. This is important because by this way we can reduce transport-related emissions. It's very, we have already just now measuring how much emissions we just making with this, and we are trying to make, we have already opened a data platform in the municipality, but we are just trying to improve that one. And also by this way, we are trying to provide safe, healthy, and more cheaper products to our really citizens. But just, we are not talking about just food distribution in the food insecurity. We have also community gardens. But in community gardens model, we use this area is also more innovative way. For example, I can give one last example. We have a funded project supported by İKLEVİ and Zurich Foundation. We implanted climate resilience programs in vulnerable neighborhood exposed to flooding and heat waves, and especially women and children we focused on because they are working in the community garden. We have four directorates, health, women, and also climate and also agriculture. They work together and they give trainings to the women and children. And more than 3,000 residents just joined these, trainings. And at the end of the training, I can share the numbers, but the interesting, for example, 120 women just became volunteer for the especially flood issues, for the disaster resilience. It is very important by our side, really. And also at the same time, we have just built a climate-friendly greenhouse in the just center of the community gardens. This greenhouse now begins to produce 60,000 seedlings annually in a year. So we can have just ability to give all the seeds to all over our community gardens and other community gardens in our other municipalities, really. And these are all just produced locally. It's really important in our sites. Also, climate issue is a health issue, but also health is a good way to talk about the climate issue. For example, in the community gardens area, we are talking about gender issues. We are just making, screening of the women, screening of the children. So they just really empower each other. Also, we empower the women because they produce, vegetables there. They have good vegetables for their house. Also, we have some facilities, some local bazaars, and we have just give them opportunity to sell them. So women empowerment also can be accomplished there. But there are some, there are many challenges. But the most important nowadays, we are talking about that direct access to financial possibilities for urban areas, for municipalities is very important. For example, in my country, we can't use the funds directly for climate issues. Approval of the central government is necessary. If you are opposite side of the government, it's very hard sometimes to use, really. So it is really important. In many platforms, especially U20, they are also working for the some talking about what we can offer for the governments. They are also talking about this issue very, frequently. It's very important. Finally, I want to say that cities not only implementers of the national plans. It is very important. So I give very importance this, this in global, national, and local level. And integrated governance is very important. Departments must work together, and we can learn by climate crisis how to work together. It also brings some chance, I think. And also communities must be active partners, not just beneficiaries. For example, nowadays we are planning citizen assemblies in the area. It's very important, really. At the end of the December, we will have a chance to hear from all the parts of the districts, municipalities, and our municipality, finish our citizen assemblies and to be able to hear what they are saying, really. And the important one for me is trust, because we have lost, especially the government trust. I see in the population that because they think sometimes that they say that it is nothing change. So we should build our trust really powerful. Thank you.
Thank you, Pinar. And I think you really touched upon, very crucial issues about governance, the funding. No one touched on this issue, but the funding for municipal, authorities to implement, to, initiate some activities that have positive co-benefits in terms of climate and health. So trust is definitely something, that needs to be worked on by different levels of government. But I feel that, you talk about community guardians and food security, short circuit, but sometimes there's a bit of a disconnect between what's happening on the ground and then, what's going on at the international level when you negotiate commerce, in global action plans. So our goal is really to try to connect those different levels and make them speak to one another. And you mentioned it, Councillor, our role is really to bring in local voices to, the international debate. So it's great that, both of you can be here today. Let me now turn to Andy Hayes. You are you're known to everyone. I'm not sure I really need to introduce you, but you're the Chief Scientific Advisor of this Pan-European Commission on the Climate and Health, that is an independent advisory body that has been nominated, appointed by WHO European Regional Office. You also wear many other hats, among which the co-chair of the Pathfinder Commission, which provides evidence to inform policies and action that bring benefit to both climate and health. So you're really an expert on this issue of climate and health. And we've heard you loud and clear about, the call on Sunday evening for the climate crisis to be recognized as a global public health emergency, a recommendation that really has received a lot of media attention worldwide. What has been maybe less heard, but that is also included in your report, are the recommendations you're making in relation to cities. And, there are many of them, but one chapter in particular is addressing local community initiatives. So what are the most important recommendations you would like to make to both cities and regions? And based on your, amazing career in this area, what are the urban interventions that work in terms of climate mitigation and public health?
Well, thanks very much for the introduction. I did have some slides, but
yes.
I won't bother actually. I think I won't show the slides because the panelists can't see them anyway, and you've actually heard quite a lot of the issues already. So let me very briefly just describe what the Pan-European Commission is or was, because it's officially finished its work now. It was set up by Hans Kluge, who's the regional director of the WHO European region. And it's an interesting region, it's 53 countries, so it isn't just the EU, the EU is a very important part of it, but it's very, very diverse. And as you've already heard, it's actually heating up twice as fast as the global average. So it is, perhaps rather unexpectedly, a vulnerable region, actually, to climate change, and a very diverse region. And we're already seeing the impacts of climate change on food security, crop yields, particularly in the southern part of the region. Recent assessment is that 70% of the heat-related deaths last summer in a selection of cities could be attributed to human-induced climate change. So they wouldn't have happened without human-induced climate change. And we can see the northward spread of some disease vectors like Aedes albopictus, which transmits dengue, for example. So increasingly dengue will become locally transmitted disease in Europe. This is three very brief examples. So why we set up? Well, I think Hans Kluge felt that climate change and health didn't have enough profile. It wasn't being acted on with enough urgency in the European region. And the actions that were happening were very scattered, I would say, and not coordinated. So what he was looking for was some independent view as to what could be done. And fortunately, we have an outstanding chair, Katrin Jakobsdottir, as a former Prime Minister of Iceland, a very dynamic political leader, and some excellent, all excellent actually, commissioners. I've been in quite a few commissions, but I would say this is really outstanding participation from all of them, bringing a great wealth of experience across countries, across sectors, across ministries, many of them former ministers and so on. So as you've already heard, we have 4 domains, and I won't go into great detail. The first one was about facing climate change, confronting climate change as an emergency. And we propose this, that the WHO should declare this public health emergency of international, perhaps global concern. And I must say, we've been quite gratified by the response, because it has been generally a positive response. We don't know 100% whether they'll do it. I've received notice even in the last few hours that there seems to be a groundswell of support building. So we'll see where that goes. The second was around transforming health systems. Health systems are about 4 to 5% of greenhouse gas emissions. They're also on the front line of climate change because they have to deal with the consequences of climate change. And they're essential when it comes to adapting to climate change. Better heat early warning systems, making sure our hospitals and health facilities can withstand floods and extreme heat. But also, of course, they have communication with patients, with the whole community. I spent many decades as a family doctor, and many of the patients I saw were suffering from diseases that could be prevented, from reducing their exposure to air pollution, smoking, healthier diets, more physical activity. And many of them weren't able to do that. They weren't able to take those steps because the environment was not conducive. You couldn't walk and cycle safely. You couldn't breathe clean air. You couldn't afford healthy food. So all of these are important themes. And they have very important health implications, of course, as well as environmental implications, getting those decisions right. So that takes us on to the third area, which is scaling up community-based solutions, which is what we're talking about today. But I will just mention the fourth one before I go into more detail on the third, because that's also relevant. And it was about reforming economic, financial, and regulatory systems. Because if you have the wrong systems in place, you're always going to go in the wrong direction. So if you subsidize fossil fuels, and we found another estimate, not our estimate, but we took another estimate of 440 billion euros of subsidies of fossil fuels in the European region, across the European region. I mean, that's quite extraordinary. And then people say, well, of course, it's very difficult to withdraw those when you're in a crisis where fossil fuels are suddenly very expensive. But obviously, if you've been subsidizing them for years, you can't just withdraw them overnight when they're at peak expense. So you really have to plan these things in advance, and you have to withdraw the subsidies, but you have to do it in a way which is planned and also which recycles the money that you save into the pockets of the poor and into the pockets of disadvantage in order to increase their political acceptability. So the city and urban and regional networks, the call that we made for those was really based on much of the evidence that we heard. We actually heard from Cork and Izmir. We were actually very swayed by the evidence that we heard about the importance of community-based strategies, the engagement of communities, the potential for intersectoral action. Because WHO, as you know, has to focus on the healthcare system. And yet many of these determinants are outside the control of the healthcare system. So where's the best place to intervene? Well, it's often at the city level, because we have allies there, because many of you are already working on these policies, and we can learn on WHO from the work you're doing. And the WHO Health and Cities Network has done excellent work, but it hasn't been that much engaged in the climate change agenda. So we're advocating for the fact that it needs to be engaged more, as indeed do many of the other urban networks that straddle this whole arena. So we really acknowledged a lot of the leadership that was occurring in cities and city leaderships through transport sector policies. We've heard about housing and housing retrofits, food, community gardens, a whole range of different policies that can combine adaptation and mitigation. Because we actually shouldn't think of adaptation and mitigation as two completely separate activities. If you do that, you get maladaptation. You can put air conditioning everywhere. If you do that, what happens? You increase the energy bills. What happens to the heat? You pump it out. So you increase the heat island, urban heat island effect. When you step outside the building, the heat's worse. And of course, the poor can't afford it. So we have to have solutions that integrate adaptation and mitigation, like nature-based solutions, green space in cities. One estimate is that over 40,000 premature deaths a year could be prevented in a subset of European cities just by providing green space at the level that WHO says is desirable. So within 300 meters of your home. So that helps to cool cities, but it also brings other physical and mental health benefits. So there's a lot that can be done. So there's two things that we really urged WHO to do. Well, one was themselves to develop an accountability framework to monitor and evaluate progress on climate and health, including in cities, and to create partnerships with urban and regional networks. And the second was to the cities themselves, because we know they're doing great work, but sometimes that work is not being documented. And if you don't quantify and evaluate and document what you're doing, it's always going to be open to contention, doubt. It can feed populism and also denialism. So it's really important. It isn't just for the academics. It's really important to collect data, to publish it, to engage the citizens and citizen science, for example, collecting their own data and then showing it. I think that's really an important way of changing the whole discourse around climate health and climate action, empowering citizens to collect and analyze in simple ways data on local environment and on health, and involving, of course, the local healthcare professionals. And I would say, in particular, because I worked in primary care myself, the family doctors, public health workers, as well, of course, as the hospital specialists. But it's particularly them, the primary care and public health, that are actually on the ground. So we called upon cities to formalise climate change and health in their mandates, to actually make that a formal part of their mandates, and also to publish data, to evaluate their actions, to publish it, and to learn from each other, so that we can scale up many of these activities, because they're not happening at the speed and scale that we need in order to avert the climate crisis.
Thank you so much, Andy. And I think you touched also upon a very important issue. You say, cities should put the question of climate and health on their agenda. It's all a question about political will, and it's how do you prioritize, this over, housing, over,
But it's all connected.
Yes.
So you could say, well, enter it through the housing route, but enter it through the transport route, enter it through the food route. And then at the end, we'll say, oh, well, you've done something good for the climate too. But the primary purpose was, making you health better.
But political will needs, to be, it's really central. And I think when you work with local authorities, it's right level, actually, to really start, spreading this narrative about climate and health. Thank you so much. I had a lot of questions, but I am looking at the clock. I am turning to the room, and people have been listening to you very carefully. Do you have any questions or any comments that you would like to share with our speakers today? It's your chance. Dennis from Cork.
I'm really excited by what you said in terms of what cities can do. And I think the evidence one is the one I personally am challenged with as a practitioner, because it's not my area of expertise, and also it's so time consuming. And what I'm noticing in a lot of the EU funded projects in this area, there's a huge amount of funding goes into research, and the research seems to be about how we can fix climate. Why isn't the research going into what are the actions we're doing and how effective are they? So I suppose my call and my question is, how do we shift that funding of research into action-based research rather than us having to be research-based actions?
Yeah, I mean, you're absolutely right. But I would say what we're doing at the moment with the Pathfinder project, I didn't have time to talk about it, is very much evidence for action. So that agenda is changing. It's changing from just documenting the impacts, which has been the focus of much research. By the way, climate change and health research has been underfunded for many, many years. But what research has been funded, as you say, a lot of it's around impacts and a small proportion around action. Now that's changing. Some of the big funders, like the Wellcome Trust, for example, are now funding a lot more on evaluating climate actions. And that's definitely the way to go for the future. The EU, I'm not so sure, but I think they're also increasing research effort on climate action for health. So we are seeing a cultural change. But of course, that's quite a big step for many researchers, because many of them do function rather divorced from the problems of the community. whereas we try to focus very much on actions and how we can accelerate action. And that's really our priority for the future.
Thank you. Any other point, question, comment? Yes, sir, please.
Thank you so much for the invitation. This is Dr. from Saudi Arabia. I know most of the attendees and also from Europe. I might give a little bit of note about Saudi Arabia. I'm the Director General of Global Health in Ministry of Health in Saudi Arabia and also advisor to the Deputy Minister for Population Health. We just developed National Population Health Framework, and we learn a lot from healthy cities. So we implemented the healthy cities in the population health framework in my country, and we have the WHO Collaboration Center in the Embu region, and now there are 1/4 of the population live in healthy cities in Saudi Arabia. So I'm talking about those who got the certificate from WHO. And we have a goal in 2030 to reach 100%. There are 85 inputs from WHO as indicators, and now we are linking them as an outcome. So if you are doing that, we need to see the results at the end. So this is part of what we are doing. We learn, and now we are trying to change to the population segmentation and do the right intervention for the population. My country is a big country, but we believe in health cities, and we learned from Europe the network. So we are building a healthy city network. It should be launched by the end of this year. It will be at a national level, linking the input with the output. And I can share with you also our population health strategy that just started this year. I was lucky and unlucky because I talked from my life to build this strategy by my team and myself. So it was a great initiative. I like what you discussed, and I can see different opinions. It's not opinions, but we should have a study, or we learn that some opinion talk about from government, from top to down, but other opinions talk about from the community. It's like bottom up. So I believe, shall we go with this or that, as though both are synergetic? Yeah. So I think if we discuss, because it's sometimes difficult for the government to do it due to some reasons, but you cannot stop the community. And at the same time, you might have some good initiative, but the community is not responding well. So I might need to hear from you about these both approach.
Thank you. Any one of you want to respond? I would imagine that indeed both approaches, top down and bottom up, are necessary. And I think we have representatives from all those kind of levels. Do you want to quickly respond? Yeah.
Yes, sure. Both is necessary. For example, in Turkey, we have national plans in many issues. Really, we are lucky. But the problem is many of the cities has not enough capacity. They need support. Izmir is lucky. But I know that in many cities from her national network of Turkey, Health Cities National Network, they don't have enough capacity. So we should find also supporting them and just making them to do, also giving, sharing their experiences, what they built from bottom to the top, really.
Yeah, I suppose two other examples in terms of political challenges is one avenue to explore is within your local authority or your municipality, the policy committees. So what we did in Cork is we have 5 SPCs, the strategic policy committees, which have external partners as well as politicians, and also the members of the executive of the council, who are actually, employed to activate on the ground whatever needs to be done in our parks, in our houses, in our city. So what we did was we brought our own action plan, our own city healthy cities action plan, to each of the strategic policy committees, so that the whole council, all of the council members, were made aware of the need of these issues, and to endorse it. And in fact, it was an awareness became a quite starting awareness from the politicians that this is what we were doing already, had a brand called Healthy Cities. But it also gave an opportunity for the executive to understand what we were trying to do. And then what we did, we brought it back to the whole council for the whole council to endorse it. So that was important. And then when we were developing the city development plan, we also made sure that healthy cities were at the core of the conversation with all of the stakeholders, so that health was put at the center of the priorities for our city development plan moving into the next term. So that's one avenue to explore if you want to, challenge the political system in it. The second one then is the mission city that I spoke earlier, is exactly what Andrew was saying, is involving all of the stakeholders like universities, the businesses, and involving retail was a huge one as well, because at the same time, like, it took us a pandemic to know that we could eat outdoors. So pedestrianizing our streets and involving all of the stakeholders as part of the mission city agenda was important. So you're trying to engage as many people as possible in addressing the issues that are before us. So while you have at local level community gardens, community groups, all of that, you also have the wider network of people in terms of the universities, the retail, all of that, the businesses, chamber of commerce, all of those. So you're trying to reach out to as many people as possible. But I think the key is to make sure that every directorate, which is every department within your local authority, has an understanding that health and climate change is an important priority for each of the directors. So whether you're maintaining the houses, in retrofitting them, or you're developing your infrastructure and your roads, you must put that as a priority. Now, coming back to funding, which I'll finish up on, of course, and I've sat in 20 budgets, in local authorities where you have an X amount of money to spend. Money is coming in from development charges and all of that, and then you want to spend as much, because the local sports groups and all of those wants their slice of the cake. But it is important that you manage that in such a way that you have an impact in local communities. But that is a challenge, when you're looking at, going into a budget period of distributing the funds.
And it's a challenge worldwide, I would say.
Very quickly, I just want to add to that not top of policy, we're quite good. The policies are there. The grassroots are ready, but it's the middle, and that's what you've just described. Actually, it's the middle out is actually where we should be focusing our energy. So it's the people in the jobs and in the system, so that the system enables the communities and the policy to actually function. And sometimes we focus on the policy and we focus on the grassroots and we forget that middle, and you just described how we try to overcome it.
We could be, discussing forever. I would invite everyone to continue discussing in the entrance hall there, where you have a nice cocktail. We didn't even have time to ask for Q&A on the online. Sorry about this, but central point is that climate and health objectives cannot be achieved without cities. I think you've heard it very loud and clear. Cities are where the risks are concentrated, but also where the solution can be found. And if we want all those global commitments adopted by states at the international level to become reality, we need cities, we need regions as partners to implement them on the ground. As you said, they're not only implementers, cities, they're more than that. They're really genuine partners in global policy making. It's fantastic to hear that there's, a new healthy cities in the Emerald region, definitely something you can learn with the European Healthy City Network. It's also very interesting to hear that you can use those tools that are being, provided by WHO, either provided by WHO or by states with this global action plan, so that cities can hold their own government, central government, accountable about their commitments they're taking. Thank you so much for the discussion. You wanted to, you have the finishing word, Ambassador.
Well, no, thank you. No, just very brief words. Number one, to congratulate the as Saudi Arabian government for this plan. We have heard of this plan already in Peru. We are working together closely with your authorities in order to see how we can help each other. And I think they are the negotiations and information transactions are going very well. But I thought, thank you very much for that and congratulations. But I wanted to add to this, I think, false dilemma between the top bottom or the bottom up
Or top down.
top down. You know, yes, I think when we think like this, we are thinking on the dynamics of the problem. Okay? And when you study math, the dynamics of a problem are normally the most complex ones. That is true. But if you don't have the statics good, then you would rather have afterwards problems. So what I'm trying to say is, okay, you can have both types of approach, but one thing is fundamental: you have to have very good institutional structures that are consensus based, they are reality based, and that they are exactly resilient. We'll say it's an environmental word, not resilient to the pass of time. Institutional frameworks is so important. And if we begin from top or begin from bottom, okay, well, we can manage. Thank you very much. And thank you again.
Thank you, Ambassador.